What is No Tobacco Day and when is it observed?
World No Tobacco Day has been designated by World Health Organization in 1987.
What is the significance of No Tobacco Day?
Significance is that in the current scenario, smoking affects various body parts.
What are the main health risks in consuming tobacco?
The main organ which is affected by smoking.
How does tobacco use affects non-smokers?
Passive smoking, that's called passive smoking.
What are the effective steps or methods that one can take to quit smoking?
So there are again two different approaches to quitting smoking. On one hand, you have behavioral modification. On the other hand, you have pharmacological measures.
How can community support individual in quitting smoking?
I'm not smoking from 1st of April, not to fool people, but just to help them help you to stop smoking. So make a public declaration.
What roles does tobacco advertisements play?
Tobacco advertisements are very crafty. They are very, very manipulative, particularly towards children.
What are some misconceptions about tobacco?
I find some people, when I see the patients in my OPD and inpatient, they say, I don't smoke, I just chew them. They feel it's less harmful.
Hello everyone, I am Pooja Goswami welcoming you to a discussion on World No Tobacco Day, which is on May 31st. Today we have the privilege to introduce you to a remarkable individual who has dedicated his life to the field of pulmonology and changing life with his experience and commitments. Meet Dr. Pradeep Simha, the Senior Consultant Pulmonologist at Continental Hospitals, Hyderabad.
So what is No Tobacco Day and when is it observed?
So World No Tobacco Day has been designated by World Health Organization in 1987 on 31st of May of every year. And the purpose of this day is to give an opportunity for various people across the various walks of the life, including the doctors, healthcare professionals, and community workers, etc., to increase the awareness of the dangers of smoking in our communities and spread the word that it is never late to stop smoking, and encourage people to give up smoking and talk to each other about smoking, and in general increase the awareness across the communities about the dangers of smoking.
What is the significance of No Tobacco Day?
Significance is that in the current scenario, smoking affects various body parts. It's a cause for various health issues, not just lung. Lung is the primary organ which takes the brunt of smoking in the form of having conditions like chronic obstructive pulmonary disease, lung cancers, asthma, and other conditions. In addition to lung, it affects the heart, oral cavity, and kidney and other body organs. Let's talk about it. Let's talk about smoking, the dangers of smoking, and let's see how we can rid the world of this vice, which I feel is the bigger than any other vice currently.
What are the main health risks in consuming tobacco?
The main organ which is affected by smoking. I'm being a pulmonologist. My work day to day is to see patients who have been facing the main damage secondary to smoking. Long-term smoking affects damages where the lungs in the form of causing a condition called as chronic obstructive pulmonary disease. What happens in this condition is that the breathing tubes become narrow, so there is less space for the air to move, and when it moves around the narrowed breathing tubes, it causes sounds such as wheezing. And the main symptoms of this condition are chronic cough, breathlessness, wheezing, and repeated chest infections. So that is the most important condition which is caused due to smoking. Again, smoking is the biggest risk factor for lung cancer. Smoke, as we know, contains at least 1,000 carcinogens, proven carcinogens. So long-term exposure to smoking increases the risk of lung cancer. It also worsens underlying other lung conditions, such as if you're an asthmatic or if you have a family history of asthma, you add fuel to the fire by smoking and being exposed to someone else smoking as well. Apart from lung conditions, smoking is very well known thrombogenic. So it can cause thrombosis or blood clots in various body parts. It is a leading risk factor for coronary artery disease, which is just blockages in the arteries supplying the heart. A leading risk factor for strokes, causing body paralysis. It is a risk factor for having oral cancers. Smoking is a risk factor for renal cell carcinoma and bladder cancers as well. So it can affect various body parts and organ systems. It is, in addition to causing these various conditions in across the body parts, it is a highly addictive substance as well. Apart from the carcinogens, the substance that is primarily present in cigarette smoke is nicotine. Nicotine is a potent stimulant and a highly addictive substance. It's more addictive than alcohol. So what nicotine does, it binds to various nicotine receptors in the brain. It causes a high effect or a stimulation of system, which increases the concentration and boosts productivity in the short term. But however, in the long term, it can be highly addictive, and it can make you dependent on those stimuli. So two components: nicotine on one hand and carcinogens on the other hand. Nicotine gives the stimulation and makes you dependent on it, while long-term exposure to these carcinogens cause cancers in various organs in the body.
How does tobacco use affects non-smokers?
Passive smoking, that's called passive smoking. Okay. So the effects of passive smoking are almost as dangerous as active smoking. So just because you have never smoked, you cannot assume that you will not get those conditions secondary to that we get because of direct smoking. So if you this is quite commonly seen in people who work in bars across the Western countries. They, even though they don't smoke, they are exposed to high levels of smoke in the indoors, and they are prone to developing COPD and lung cancer as good as any direct smoker. And in Indian context, especially in the rural setting, women are exposed to biomass fuels, particularly during cooking. They use firewood, they use coal, dried cow dung, for example. All these emit various toxic substances and carcinogens. And long-term exposure can cause COPD, which is primarily due to cigarette smoking in the Western countries. Yes, in Indian setting, exposure to biomass fuels causes all the effects that we see typically due to cigarette smoking.
What are the effective steps or methods that one can take to quit smoking?
So there are again two different approaches to quitting smoking. On one hand, you have behavioral modification. On the other hand, you have pharmacological measures. So behavioral modification accounts to around 70% of your efforts to quit smoking. And it's only supplemented by medications and other supplements, they account for only 30% of it. So what I do for people who smoke a lot, I counsel them. I find it's surprising that many of them are not fully aware of the dangers of cigarette smoking. They often think it's a cool thing to do, or it's a habit. Often they pick it up during their early adulthood, during adolescence, when they are not aware of smoking dangers of smoking. So first and foremost, again, this is where this World No Smoking Day, helps. Various hospitals and healthcare institutions, they develop educational videos and material out in the media, which common people to make use of that. And again, this going back to our first question, what is the objective of World No Tobacco Day? This is exactly the purpose. So increasing the awareness of dangers of smoking. That is the most important thing. While Western countries are increasingly reducing smoking or quitting smoking because of increased awareness, the developing countries are picking up, unfortunately, and the rates of smoking are increasing in the developing countries. It is very important that this message reaches out not just to the urban audience, but the rural audience, where cigarette smoking is increasing. So, coming back to your main question, which was
Methods to quit smoking.
methods to quit smoking. So, one is increasing the awareness. Again, that itself is quite enough for a lot of people. They get scared. They don't want to. No one in right minds would like to have lung cancer or COPD. So you improve their understanding of what smoking does to you. People quit smoking, and often smoking is tied to various habits during the day. When I speak to people and take their history, what exactly makes you smoke? Often they associate with a cup of coffee. So they cannot complete a cup of coffee without cigarette in the other hand. They often associate with with their associations with friends, for example, or even certain personal habits are associated with smoking. So we need to untie all these associations. Often that helps. And again, once you've done all that, it's the medicines. What kind of medicines do we have to quit smoking? One is nicotine replacement therapy.
Right.
So nicotine replacement. So what your body is craving for is some more nicotine. Okay,
Right.
and that's the reason you get all these headaches and withdrawal symptoms. So give them some nicotine. Now, how are we going to do that? There are various ways of doing that. People would have heard about vaping.
Yeah, right.
Yeah, so vaping is you have this basically nicotine vapors. You get rid of all the toxins and carcinogens from the cigarette smoke, and you just inhale nicotine. So nicotine will satisfy your urge for having nicotine. So you are just smoking nicotine. It is considerably less harmful than cigarette smoking, and it is approved for smoking cessation therapies. Okay, vaping. However, it's not completely safe. It is not completely safe, but it is much safer than cigarette smoking. If you want to use vaping as a bridge to stopping smoking, that is very well approved and a very acceptable thing to do. But if you want to start off vaping as a habit, de novo, means you're not a smoker, you just want to pick up vaping because it is safe, then it is not safe. Okay, because it does, long-term vaping does cause similar damage to the lung as smoking. Okay, for example, in terms of COPD, chronic obstructive pulmonary disease. However, it is devoid of all the carcinogens, so it may have less less effect on causing cancer, but it can still cause as much COPD, chronic obstructive pulmonary disease, as cigarette smoking. Okay, so it is approved as a smoking cessation tool. So if someone is smoking 10-20 cigarettes a day, I will initially ask them to switch on to vaping instead of smoking. Okay, but again, there should be clear time frame. When they want to stop vaping as well. I don't want to replace smoking with vaping in the long term. Okay, use vaping for a duration of few months to 3 months, and then see if it helps you quit smoking. Then that's a very acceptable thing to do. So first thing that is very effective, vaping has been proven to be a good smoking cessation tool. Number two, you have nicotine replacement patches and gums. So patches are a little patch which are applied over skin. They release nicotine into your bloodstream slowly. It's changed once a day, and the dose is determined by how much cigarettes you are smoking by a healthcare professional. And again, there is a course for that. It's not a lifelong treatment, so it should be used in conjunction with your behavioral modification. So it's just helping you to quit smoking. Okay, so you can use gums as well, according to the patch, along with the patches. There are certain other treatments, which are a bit more specialized. I think that needs to be discussed on an individual basis. Okay, and that can be done in any OPD setting or in a smoking cessation clinic.
How can community support individual in quitting smoking?
Okay, that is very important. The people around you can make or mar your efforts to stop smoking. So if you have a good friends group or family, first thing you need to do is make a public declaration that you're stopping smoking. Okay, if you keep that secret to yourself, people will not be able to help you. Okay, so make an effort, make a public declaration. I'm not smoking from 1st of April, not to fool people, but just to help them help you to stop smoking. So make a public declaration, and once you've done that, people will get back to you if you're smoking in front of them. Communities help, with the family members. If you make a declaration that you're stopping smoking, most people will be supportive of that decision, and they can prompt you or prod you, if you're deviating. Again, in other ways, the larger community can be supportive by having no smoking places. Hospital, for example, is a no smoking area, and bus stops are no smoking areas. Make public places no smoking areas. That comes in the form of bigger governmental intervention or policy changes. So that's how and lots of Western places, they have come up with this kind of no smoking areas. So that can be, reducing the acceptance of smoking in the public areas. And other things make it less glamorous. We see these movies, wherein the heroes will be holding a cigarette in their hands and smoking. That's making things glamorous for younger people and impressionable people who don't know the harms of smoking. So I think it should go with a statutory warning, and these kind of scenes in the movies can be sort of banned if possible, or limited, so that these things don't become acceptable in the wider communities.
What roles does tobacco advertisements play?
Tobacco advertisements are very crafty. They are very, very manipulative, particularly towards children. This year's tagline for smoking cessation is to prevent or smoking industry manipulating the children. That is the main theme of this year's smoking cessation day. So all these tobacco companies, if they want to continue their billion-dollar industry, they need to find new customers. Every year they're losing customers in the form of people dying of smoking-related health conditions. Every year lots of people are stopping smoking because of efforts like ours, the healthcare industry. So they need to find new customers to fill up that drop in revenue. So they target younger, teenagers, adolescents, and young children, young people to take up smoking. The way they do that is through advertising in a soft way. A lot of these movies, I'm sure they're sponsored by, behind the scenes, sponsored by various smoking, industries and brands. Again, these kind of things, often they don't really advertise like they advertise any food or drink.
Yeah, you're right.
They advertise very subtly, making it acceptable in the community and giving soft messages to younger people who are more impressionable. I think these things should be spotted and more regulated better by governmental agencies, so that we don't find it more acceptable for young children. Chewing tobacco can also cause various health problems. We discussed that in the earlier question. Chewing tobacco can cause oral cancers, and esophageal cancers. So that is one misconception. Again, another misconception that people have is that passive smoking does not cause as much harm as active smoking. Again, passive smoking can be a risk factor for cancer. It can be a risk factor for COPD as well. So again, both smokers and non-smokers should be careful about this passive smoking. If you're a smoker, make sure you don't do it in a room full of people, especially when there are young children in the room. If you're a non-smoker, make sure that you protect yourself from consistent smoke from a non-smoking partner, or from a smoking partner or a family member. You got to take your precaution. You can ask them to go out and smoke, or you get out of the room, if you don't have the ability to get them out of the room.
Thank you, doctor. It was a lovely session with you.
Thank you for having me on. It's always a pleasure talking about various health topics.
Thank you.
Thank you so much for watching this video till the end. Stay tuned with us for more informative videos and don't forget to like and subscribe to our YouTube channel.